Hi, this is Dr. Serena Satcher, and we are talking about stress this month. So, the next question was, do the treatment options for stress differ according to the severity? So, treatment options do differ according to the root causes and according to the severity. So, an example I can think of is a person who works on third shift who's newly married and having problems in their marriage. A holistic doctor will address and test hormonal functioning in the third shift worker. That person with chronic stress and with chronic lack of sleep is likely to have blood sugar and insulin problems. They're likely to have problems with their sex hormones and sexual functioning due to sleeping off circadian rhythm and going against normal rhythms for a human. So this person would likely feel a lot of anxiety and they may also have blood pressure issues, complex problems with sleep, and they may be sleeping during the day, during the week. And while off work on the weekends, they might be sleeping at night, which is really confusing their body. So this would make the issues I mentioned even worse and difficult to deal with. And that person may be short tempered and inflexible, and they may be having problems at work and with work performance. So, this is a case where we're going to need to do some intervention in order to get the stress under control. Other people, maybe they're having episodic stress and it's not so serious because they're able to self manage with some simple changes in lifestyle.